4. You're 1/3 of the way through now. Now, exam 1 is the hardest. And I think it's a lot to do with the theorist. And the theorist is trying to remember who does what when and what's the name of those things. And whereas you have cranial nerves, facial nerves, there's all of these words and then acronyms and jingle-lingles you can remember. I can't think of anything that will work really good for you for these. So I've tried to explain it the best I could. I'm telling you, you'll see it again. The two that are used, well, three that are used a lot is infants, trust versus mistrust, and you'll see it on your HESI. You also will see school age. What is their industry? What do they do well? And then adolescence, all about identity. Those three you're always going to see again. So I'm just warning you, if you didn't see them, go back, look at it again, so that you can understand it. Remember, anybody who wants to go over the exam, I am more than willing. Let me know when you're available and I will work with you, okay? Grades are not up till Saturday. And the reason is we have a class that is on Friday from 8 to 10:30. So we're not doing it at 11 o'clock at night on a Friday, doing what we call an item analysis, which means me and the whole pediatric team get together and look at the questions. And we see the ones that are most missed by the students. And we say, was the question fair? Or was it misworded? Or could have been two answers as the answer instead of just one. So one of the things we do is to make sure your exams are fair. I think I see 2 questions right now that I might give back, okay? So this week, we did have some issues with CJ Sims last week, and it wasn't just this place, this class, it was across all of the different community leadership, the PN side, all over. I think everybody on Sunday was trying to get into CJ Sims, and I think they just crashed. So I'm giving you till next Sunday, this coming Sunday, to get last week's done if you couldn't get it done. Remember, there is another one due for this week, and also you have a discussion question. So make sure you get those done, and I will be grading them. If anybody has any issues about that citation and what does that mean, come on with me. It takes 5 minutes. I don't want to spend an hour of anybody's time. Once you come on Zoom with me, you're not stuck. I don't believe in absorbing your time and talking about it. I just want to get you understood, that you can understand, because many of you, I know this area, many of like Baptists want you to be BSNs. Nicholas Children want you to be BSNs. So I know what you're coming up to when you're going for that degree. It's all papers. It's all PowerPoints. It is all brochures. So you need to know APA. And that's the biggest things, APA. So I'm just introducing you. So let's go ahead. Any questions? Anything I need to answer to anybody right now? I think I've answered everybody's emails, what everybody needs. I think I'm pretty quick about it, because I'm always checking my phone, and, usually I'll even watch a movie late at night. And during that movie, I'll be checking every now and then for y'all, making sure, because some of you get stuff done at night, right? You work all day. So in the evenings is when you're doing it. So I try to answer your questions. We should be done right around 10:15, okay? 10:15. And that's where I was with the other one. And again, I'm going to send you also the PowerPoint recording. It's previous that I had, that I went back and looked it up. I think it was from April term. But the chapter 39 is the one you really need to look at. It's the variations between adult and children. What is the difference, okay? And there are some key things. Again, remember, send me your diagnoses. ADHD is taken. There's too many of them. So think about something else, or ask me. I might be able to give you an idea. And tell me what you like. Do you like lungs? Do you like kidneys? Do you like the heart, the brain? I'll give you something, okay?
Professor, quick question. Sorry to
Sure.
interrupt. Do we have a set date for exam 2 already or
It's
no?
week 7.
Okay.
It is week 7, and exam 3 is week 10. Okay?
Okay. Okay.
Okie dokie. All right, let's go ahead and let's get going.
Hold on, I'm trying to get on.
Sorry, you could get there. Week 4. It's amazing. It goes so quick, guys. Early detection of a hearing impairment is critical. Which one is of primary importance? Well, when they're talking about hearing, hearing affects so many different things, right? Number one, I could tell you, a child who's sitting there in school who doesn't look interested, not looking at the board, what the teacher's doing, there could be many things going on. It could be hearing or it could be vision. Now, when you're talking about hearing, it affects your speech. Just think about it. If you can't hear, how can you pronunciate the words? So they'll be more of a garbled because they can't get it. Okay. So if we see problems with speech before we do therapy, they're going to go for a hearing evaluation just to be sure. Okay.
What is a pin?
Toddler's playing outside, get a laceration on her forearm. He needs stitches. What can make this easier? The pin 450-8616. So a toddler, this ages 1 to 3, they're out there, falls, gets this big slice, needs stitches. You know, it's going to be a big deal. Again, it's needles, it's holding them down. He's scared. Remember, they're afraid of people who will inflict pain. That's us. We're in uniforms, right? So let's make it as atraumatic as possible, decrease the pain. We're going to put numbing cream. And then, have you ever heard of child life? Nicholas Children is amazing about child life. This is something that was introduced about 2010, I want to say, at Nicholas. And these are extremely well educated people, and they're educated about growth and development. And they're taught how to teach children on their level all about medical terms, needs, what's going to happen. They show them the little tube of the IV. They show them arm boards, tape. They do all of these things and then distract them while you're doing it. I've had children with being held by mommy, which is my program, Huggies, have them hold by mommy, and then have Child Life showing them a video, and they're putting staples in the head. And the kids don't really care because they don't feel it, they're not scared, and they're playing, right? Child Life is amazing. A parent recognizes that their toddler has a speech delay compared to the older siblings. What's your priority when you hear that? Remember, always listen to a parent. Parents know. Parents fight for their children's rights all the time, and I will never deny a parent. So if there's a speech delay, number one, we're going for a hearing evaluation, right? It could be there's a difference in children, right? Because all kids are different, but let's rule out, make sure it is not the hearing. So hearing, speech, they're together. A multi. What are signs of an early indicator of impaired cognition? You know, this is how you think, how you move. This could be related to Down syndrome, autism, or it could just be poor nutrition, right? And they're not getting good cognition because they're not getting their calories, but they're delayed. How do we know that? Well, we know they should be saying at least one word by 1 year. Mommy, daddy, Nana was mine with my grandson. They should be able to grasp things voluntarily by 7 months. And many of these kids, as they get older, they're going to behave not the way you want. And why? They can't express what they want because they can't tell you. and they get frustrated, and then they just start acting out because they can't, and it makes sense. A child is being treated for a fever. The reason for treating the child's fever is what? You know, I always hear parents come in, Nicholas, and I was in the triage forever, and I always hear fiebre muy alta. And the parents are really nervous. Now, the first thing I say is, okay, your child has a fever. He already has the fever. Most of the danger is gone. I have never, ever, in all my years working in children, and I've seen fevers over 106, okay? They've never had a seizure or any problems from it. They have problems with those febrile seizures, which means, you know, right now they have a fever of 99, and all of a sudden, 20 minutes later, it's 101. The rate of rise was so high, it sparks the brain and they have a febrile seizure. Now, usually these febrile seizures last from about 6 months till about 6 years old and they grow out of them. My firstborn grandson had one, and he's now old enough so he grew out of them. And I know what a parent goes through. They carry thermometers and antipyretics with them all the time. And when in doubt, they always, my daughter-in-law would always dose the kids because she didn't want to see that again. Now, how do you feel when you have a fever? You feel horrible, don't you? Kids do too. When they are with a fever, they're not going to eat or drink. Well, you want them to drink, right? How do you treat a fever? Antipyretics and something to drink that helps bring it down. So relieve the discomfort. The kid feels better. He's eating and drinking and happy. When the fever comes back, he's going to sit back down again, and you're going to know it's back up. A multi. A child complains of something is in their eye, causing tearing and pain. What do you do? There's something in that eye. They were outside, they were playing. Well, the book will tell you if it's tearing and you see something floating, you can take a tissue and get it out. If you're also looking at the eyes because of tearing and pain, always check to make sure how the pupils are reacting. Very important. Is there really bad eye damage? And if there's anything penetrating, this is something you're going to put on what we call a Fox shield. You know, usually we have those nice, soft, you know, gauzy type of eye patches. It's not that. It's a hard one so that it sort of shields it and it doesn't touch the eye. And it protects the eye, and you put on both. Get them to pediatric ER or pediatric ophthalmologist, and they know whether they should remove it, what's going to happen with it. Separation anxiety in a child hospitalized. Which behavior indicates a stage of despair? Now, there's 3 stages of separation anxiety. You need to know what they are. This is when mommy has to go. She has to go to work. She has to go take care of the other child. She can't be there. And now you have a young child, 3 years old, 2 years old, 4 years old, and they're really, really upset. So that despair is, first they start out with angry, screaming, yelling, crying, 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 and then they realize mommy's not coming. Then all of a sudden they go into this despair. They start sucking their thumb, their finger again. You know, they're incontinent when they're potty trained, or they're holding their blankie. I mean, you could see them quiet in the corner. They're like, mommy's not coming, it's okay. And then the 3rd stage is when mommy comes back and they don't pay attention to mommy. She's been long gone. So it's like, well, I don't know who you are anymore because you weren't here because I screamed for you. Okay? So 3 stages of separation anxiety. A child with a history of abuse. Which therapy explores emotional problems? This is something that could be done by your child life specialist. Children sometimes don't know words, right? They don't know right, wrong, but they can show you with dolls and things what sort of abuse went on. And it's just called play therapy. We sit there with stuff and they can show you what happened. And, having that person there guide sort of the conversation of play, and they could see if they were touched or if they were hit or whatever was going on. Children remember, they're so beautiful and special. They don't know not to say anything. They're going to show you things that you're going to say, whoa, I, sometimes you don't want to know, to tell you the truth. A multi. When can child react to the stress and anxiety of hospitalization? Children do have stress and they do have anxiety. And why is it? They're away from their normal routines. They're in a different bed. People are walking in, touching them. A lot of times we have to do things that could hurt them a little bit, right? And it doesn't matter before, during, and after, all the times. Especially those children who are in and out and have had multiple experiences, they'll probably be the most stressed. But children do remain stressed about it. And it's something that parents need to talk to them about, because it could be like a PTSD thing. Because depending on what happened in the hospital, remember, as nurses, you need to make it fun. Hospitals should be fun, shouldn't be stressful. A multi. An adolescent goes to the ER for treatment without the parents. How do you get consent for the treatment? Consents will always be on your NCLEX, always. And many times this is on your HESI. This is one of those questions about HIPAA, right? And doing the right thing and having proper consent. So if a child is 18 years old and is cognitively aware, competent, because there are CP nonverbal children that are 18 that do not sign for their treatment, but an 18-year-old awake, alert, and oriented, if a parent walks in that room, you must ask that child, may I speak candidly in front of your parents or your mother or your grandma, whoever it is. Remember that, very important. Another thing is they come in on the copter, trauma alerted in. These children don't need a consent. They're in emergency treatment. 2 physicians can warrant that signature and make it okay. But as soon as possible, they'll get a telephone consent. Usually, parents usually are on their way in. So we usually will either wait or we'll get a telephone consent if we need to. A child is extremely fearful of hospitalization. What types of play explores these fears? And this is what we call dramatic. Just think of the drama. They've been in a hospital with a drama, right? So dramatic play. Cooperative play is what? 2 or more children playing together with a goal. They're going to win the game. They're going to build the house. They're going to build the castle. Or it's checkers. They're going to take all the checkers, okay? That's cooperative play. Diversional is what we do for pain. We do things that they don't think about what's going on or that they have pain. And solitary, they play alone. And that doesn't explore fear. It's dramatic play. When checking an IV in an infant, you notice that the tissue around the IV is swollen. Your first action, what do you do first? Remember, an infant could be weighing, 5 pounds, and then you put in 10, 20 mLs of fluid. That could be a lot of fluid, right? If it's swollen, what are you going to do first? Number one, you're going to stop it. You're going to find out if it was one of those things that you need to put in like Regitine in it, so that it, doesn't, if it's like a vasopressor and it's vasoconstricting those veins, you want to put something in there to open those vessels up so the blood gets there, so the tissue don't die. And then you're going to put a warm pack on it. It dilates it again, helps with the swelling to go down, and always elevate it. But number one, stop it. You're not going to flush it. If it's already swollen, look at it. Don't try to flush it. You're just putting more fluid in there. In helping a child to adapt to a hospitalization experience, the best approach is couple things with children and hospitalization that just make it a lot easier. Remember, children don't want to be there. And number one, they don't like the change of routine. And that routine includes, if they can, eating the same types of food, having the bath at the same time, getting up, eating breakfast, getting changed, brushing their teeth, taking a nap, playing, all of those things. If they know when it's coming, they're happy. And when they don't know, it's when they get stressed out. Bringing the toys, that's after the routine. Bringing toys in, and the other one is keeping the parents at bedside at all possible. That is the number one. It can't always happen though. When assessing vision on a child, the healthcare provider would use the Snellen chart. At what distance? You're going back to health assessment there, aren't you? And it is 20 feet. And remember, it's the same for kids, but it's probably not going to be letters. It could be faces, right? Different things that different children of different ages can understand, all right? They can't see things up and down, sideways. They don't know what that means. So it would be a different one, age appropriate. A multi. Nursing care of discharging a child to home. The kid got better, well enough, needs to go home. What do you as a nurse need to make sure that you do? Which means we're discharging the child home as safely as possible. And that is, we're going to send telephone numbers down. We're going to explain what do we tell you is going to happen and what day it's going to happen on. If you've had, adenoids or tonsils, and they're not going to feel good for like 3 days, and then slowly they'll feel better. We need to let them know that. And it's not only the parents we talk to. What about the 3-4-year-old? They understand. So if they understand, they're going to be more compliant, okay? And then the last thing is, with written instructions, make sure that the parent verbalizes understanding. Do you understand what this means? And then you're sending your kid home to a safe environment. They know what's going on. So what is the 3-year-old biggest stressor of being hospitalized? This is your preschooler. That's right at the end of toddler. This is preschooler. Biggest fear, biggest stress. And that's separation from parents. I have watched the evolution of the way parents have been able to stay with their children longer and longer. I mean, even today, they are allowed to go into the ORs. The children are put on a mask, put to sleep, then they start the IVs with the parents with them. So the child has never had a chance to be stressed. And as soon as they wake up, they call the parents in to recovery room. So this is a change in practice that really helps with the stress for these children. So parents at bedside. No, so you want routine, parents at bedside, and toys from home or food from home. What is the best way to alleviate the stress and anxiety of a hospitalized child? 1, 2, and 3. Keep them on the same routine, get the parents there. And again, remember, include the child. Let him know what's going on and always be on the level of the child so that they understand you. We don't today do anything in their room. We'll take them out. That bed there where they sleep has to be a safe place so they don't feel like somebody's going to come in and do something to them, because that's what they feel like. A nurse notes a string tied around the infant's wrist. An appropriate nursing intervention would be what? I got one of these little things. It's blue and white. It was from a Colombian family, but I know in Miami they're black and white, right? And many times they are in little wrists, they're on their thing, they're on necklaces. I came to Miami, I had no clue what they were, not at all. Well, now I know it's to ward away evil spirits. I was given this thing about 20 years ago now, and I don't take it off because I like the meaning of it and why these parents gave it to me. So when you see something you don't understand, remember cultures, everybody's different. Ask the parents, what is it? Don't just go ahead and cut it off, all right? Unless it's impeding circulation or whatnot. But always ask before you try to take it off. How can a hearing impairment develop? It doesn't matter. All the things could be there at birth, could be from illnesses, could be chronic infections. Many things can cause it. And a lot of times you're going to see and understand it because there's speech. And that will go and make you look at the hearing and see, oh, they're not hearing. Because kids are always hearing impaired. They don't know that they can't hear. Which urine collection method on an infant is most accurate? Remember, if you're getting a urine specimen on an infant, infants are immunosuppressed. They don't have a big immune system. So we need something accurate so that we give one dose of antibiotics, not going back and doing it over and over again. So the only way that we'll do infant urines is a catheterization, straight cath, in and out. The bag urine, it's getting contaminants from the skin. How are you going to do a clean catch on an infant? Hold them up, let them clean it, and wait for them to urinate and then catch it? It's not going to happen. So it is a straight cath. And, most parents don't like it, but when you explain why it's important to get the proper antibiotic the first time, they're more amenable to go ahead. And I tell them, it's not, it hurts. They just don't like to be held down. It's uncomfortable for a second and then it's done. A multi. What is the purpose and function of the family? As nurses, we need to know this because you're not dealing with just a child. You have a whole family. And it's grandma, grandpa, aunt, uncle, next door neighbor, best friend, all of these things. This is all family. So they're that safe environment, that's an emotional security and comfort. And that's where all the values come from, the way they act, the way they believe. Ensuring financial assistance, no, that's not the purpose of the family when we talk about pediatrics. It's the other. The primary goal in caring for the child with cognitive impairment is to do what? Well, you all get the opportunity to go to Patches, which I absolutely love the place. And you're going to meet a little boy. His name is Jonathan, and he's downstairs. And the kid is nonverbal. And that kid has a smile that goes from ear to ear. And I miss my little Jonathan. Now, Jonathan is nonverbal, CP, 7 years old. And years ago, I used to work with these children as a volunteer in high school. We used to just get them up, get them out of bed, put them in a chair, feed them and put them in front of TV, then put them back in bed for a nap. And there was not the teaching today. Speech, physical, occupational therapy. Jonathan knows his colors. Jonathan knows his shapes. He doesn't verbalize, but he's got a pad. He's learned how to use, and he's actually got quite a sense of humor. So look for Jonathan when you go there. He's still there. Many infants require oxygen. What type is best tolerated and accurately delivered to an infant? No older, only the infant. So there are many ways. We have the nasal cannula, but they tape it to them and it tickles them in their nose and they put their fingers and they rip the tape off and they don't like it, okay? A trach, oh, they don't like it. And if you've ever been intubated, it is not fun. What they like is that clear plastic thing like the picture you saw. They can eat their fingers, they can suck on their pacifier, and they can see around and nothing's touching them. And you can really accurately give a proper dose of oxygen, okay? They have an oxygen sensor in there and you monitor that closely. It's called an oxy hood, and there's all different types of them. What is the best practice for school-age children with special needs? You have kids that have problems with sight, hearing, they're in wheelchairs, but these kids are smart. Maybe they can't verbalize. I had a girlfriend whose child, she had a stroke on her speech center at birth. She couldn't verbalize, but she was smart. So the best thing, put them in regular classrooms, make them feel normal, because they are, is they just have problem with hearing, vision, even speech, but they can participate, and it does encourage them to be even more than trying to put them in some special classroom. A multi. Collecting a heel stick blood specimen on an infant. We don't do many venipunctures on infants. The venipunctures we do are usually your blood coagulopathies, your PT, PTT, those things. You have to have a venipuncture and the blood flowing. CBC, chem profiles, drug levels, all can be done, with a heel stick. Now, we go to the outside of the heel, because if we go on the inside, that's where the calcaneus bone is, and it could cause osteomyelitis, especially if you use too big of a lancet and it goes too deep, okay? So only use the infant one. The other thing is don't try to get a washcloth, warm it in a microwave, or do anything like that. Infants are extremely sensitive. Only use a hospital-approved warmer. And if you hold a foot up, the blood drains down, right? I used to sit next to their stretchers or their warmers and have their leg hanging over, blood's going down, and very easily after it's warmed up, squeeze it. If you squeeze it too much, it's going to turn purple. It's going to get painful because you squeezed it so hard. You don't have to. And a CBC and a complete chem profile, 1.2 mLs. That's all it is. It's not much. Referrals for cognitive impairment should occur when you realize there's delays, fine motor delays, gross motor delays, speech delays. When you realize something's happening. And children are, whenever you see it, get it done. Early intervention ASAP, as soon as you can. Children are amazing. They can catch up extremely quickly, but you got to catch them early because they just learn. They're sponges to learn. Down's children have frequent upper respiratory infections. Why? And the reason is their noses gets deep and it's flat there. And mucus sits in there and gets stuck and they can't get it out. So what happens? It drip back and it causes that upper respiratory infection. It's not their tongue, their mouth, their neck. It is their nasal bone. It's flat. It doesn't stick out like ours does. A multi. What would be included in the care plan of a patient with moderate cognitive impairment? Like, what should you be doing for that child to help them be better, to grow, to learn, to be happy, to be less stressed? Well, put them on a structured schedule. Now, many, especially if you get into the autistic part of it, okay, they don't like lights. They don't like to be touched. They don't like sound. So start exposing them slowly to that. Always give them toys age appropriate that do something to help them. Now, you're going to meet a little boy who's a Downs autistic child. I think he's about 7 or 8 now. He still might be there. That child, Downs autistic, would walk in from the bus because the bus brings him there. He would get his backpack, walk in, take it out, put it in his cubby, sit down and wait for vital signs. A Downs autistic child. And why does he do that? Daily structured routine. And he knew what he was expected to do. That makes him happier. A multi. Autistic children demonstrate which behaviors? Now remember, there's all levels of autism. We have from low functioning to extremely high functioning. I mean, we do not diagnose these children until about the age of 2. I mean, we might have some understanding maybe before, but usually it's about 2 when we diagnose them. Definitely language delays. They're not going to be able to express what they want. As I said, they hate you looking at the eyes. They don't like that. They want to play by themselves and they're not going to pay attention to you. They're too involved in playing with a toy repetitively. Take a truck and put it on a chair and take this and put it on top and put this next to it and there. And then take that one off and this one off and take this off top, take the truck down and then put the truck back up on the chair over and over. It gives them comfort. Okay. That repetitive actions. I've watched it. And if that kid is still there, that Downs autistic, watch him. He is just exactly what I just said. A multi. Children with autism have better outcomes if what? Always that structure. That's always going to be number one. But don't let them do bad behaviors. They know better. They know what they're supposed to do, and you'll correct them, okay? And then teach them how to speak to you, how to make their needs known. And again, speech, physical, occupational therapy, all of these things do help. Multi. Fragile X causes. Now, the first most common cognitive syndrome is Downs. Number 2 is Fragile X. They're extremely similar except for one thing. These children are aggressive. These children, many of them have to be put on medications to keep them calm. Unlike Downs, you don't have that. And their physical deformities are different. They're big ears, different chin. They're just a different look than Downs. But again, intellectual, learning difficulties, yes, but aggression, that is what you see, and different type of physical deformities. Causes of autism. What causes it? It's mostly boys, and as I said, it will be diagnosed about the age of 2. And it's everything. We don't know. We wish we did. Genetics, unknown. It's the brain. It's this, it's that. We don't know. And if we did, we could correct it. But it does happen. And it is. If you have a boy born with autism, possibility it would happen again. I worked with a nurse who had one boy, had another boy a year later. They both were autistic. And then she had an oops and had a girl. And the girl is fine. But she's done everything to take care of her boys, giving them the best care. Ways children with hearing impairments communicate with each other. I mean, how do children talk to each other? Different languages, right? Some kids are only English and some kids are only Spanish here in Miami. That's a big thing. So how do they speak to each other if they don't know? Many things. And that's everything here. Sign language, finger spelling, lip reading as they get older, but it does happen, all the above. But children with hearing impairments, they're going to get their needs known, okay? Because hearing impairment doesn't mean cognitive delay. They're smart kids, they just don't hear. What is amblyopia? Well, we can see that it's an eye from that beautiful big picture. But what it is a lazy eye. That means one eye sort of goes inside, outside, up or down. It doesn't look straight ahead with the other. So it's a muscle problem. The muscle in the eye is weak, so it can't hold it straight. So how do you think we would treat it? Well, we cover the good eye with a patch, and we leave the bad eye or the eye with amblyopia open, and we make those muscles work. So we take it off and on during the day, the patch, make the eye work. And usually that's all it needs. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? Again, preschooler, ages 3 to 5. They're still very skittish of healthcare professionals. I mean, we know, number one, we get on their level. We know we have to be developmentally correct, and then let them touch and play with the equipment, or say, hey, I bet you there's a 2 in the number. What number do you think is there? And now we made a game of it. And you know something? Kids just want a game, and then they will do whatever you want. Let them push the buttons, no biggie. What child may be more stressed when hospitalized? You're a child who's been in and out frequently, most likely has had an experience that made them scared, because multiple, the chances are they have. Think about the sickle cell child, in and out with pain. They're always getting stuck with needles and IVs, et cetera, et cetera. And maybe there was one experience that gave them stress. So again, as nurses, make it fun for the kid, be honest with the kid, and be as atraumatic in their care as possible. A toddler has a hard time fixating on a single point. The child's eyes cross to the midpoint. This eye and this eye are working not together. They don't come to one point like ours does. I mean, depth perception is gone. What is that called? There's 3 different types of eye issues. One is amblyopia. That's called strabismus. And then you have the ones that the eyes sort of wiggle. That's nystagmus. There's three things you might see on eyes. A multi. Safety in administering medications to children include and then I'll ask you, is there any difference between adults and children and giving medications? Remember, children is milligrams per kilograms. It's not like giving just 2 Tylenol for fever or pain. You can't with children. There's a dose. Always, always, always have a name band on that child. And children don't always know their names. Depends on the age, maybe the older kid. And we don't do anything by room numbers. If you knew how many times rooms were changed to accommodate another admission coming in, you'd never go by rooms. Always it's going to be the child's ID badge, okay? Their ID bands. What can help the parents to make a baby swallow their medicine? So it's there in their mouth. What are you going to do? They're not swallowing. Sometimes they even try to get it out, right? Even young toddlers are like this. I mean, you can hold them down and pinch them and force it in there, but it's not a nice thing. No. What I have done, and now I have to tell parents to do it with infection control. If you get it in the side of their mouth and it's there, sometimes you might have to hold their cheeks a little. If you take a deep breath in and real quick, and they swallow it quickly. And that's what I tell you to do for your younger children. It works. And you never squirt it in the back because they're going to vomit. If you put it in food or formula and they don't eat all the food or formula, did they take all their medicine? That's the point there. So it's better to give it without or a little tiny little bit of food. And usually it's liquid for these kids. So usually it's getting it in their mouth and blowing and getting them to swallow. Treatment for amblyopia involves what? How did I tell you to treat that lazy eye? Remember, you're going to cover the good eye. Let that lazy eye, let that muscle work. Yes. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What's important? Think about a teenage Downs boy or girl. And we're talking about sexuality. Why would you want to do that with these children? I mean, we don't think they're going to have sex. The problem is, what about other people abusing them? So we need to teach them what is proper touch and what isn't, and when they should tell mommy and daddy what's going on, so they understand good and bad touch. It's well-defined code, concrete code of sexual conduct. This is the most abused area in children. A multi. A child is asking mom about his sibling in the hospital. How can you alleviate his stress and fear? During COVID, it was horrible. I mean, we as mothers, fathers, daughters, we couldn't get into our children, and the kids, absolutely not. I mean, sometimes you just don't have the time to get your kid into the hospital, right? Because of what's going on. Well, you got to still make that child feel like he's important. Have them make a card, both of them, one in the hospital if they're well enough, one at home, and send them to each other. And if they can get in there, let them know what to expect. If he has a breathing tube in, if he has lines coming, if he has a monitor that's going bing, bing, bang, bang, Let them know so they're not going to be afraid. And a multi. What are some best practices when a child is in pain? Number one, you have to understand which pain scale, right? Ages 1 to 3 and nonverbal are FLAC. And then at 3, we turn to faces. And then we go to numeric at 8 years old. Now, we've gotten the pain, they're in pain, we've given them pain medicine. Now, it's just not giving them pain medicine. There's more we can do. What if the kid had abdominal surgery and the kid's flat in the bed? Elevate the head of the bed. What if it's sickle cell? Give them a hot pack, a cold pack, help them that way. And then do something so they're not thinking about the pain, distract them. Put on a TV, give them a video game, do something. And don't do anything that creates pain without pain medicine. If you're going to get them out of bed, medicate them first. If you need to do respiratory toileting, like incentive spirometry, medicate with pain first, okay? Children do hurt, just like adults. They're not going to tell you, though. And a multi. Children can be critically ill for long periods of time. How do you prevent pressure ulcers? And yes, they can, just like adults. So you're going to keep them dry with diapers, under pads, whatever. Turning them is great. Rubbing those areas that are reddened, of course. Draw sheets so you don't get that shear injury. And in children, I use baby blankets and pillows and stuffed animals and have their ET tubes with those little tiny little animals and sitting there and looking at them. And number one, the parents love it. They think he looks like a little baby with all the little toys around him, and the child is comfortable. So these are all things that you're going to do because children do get pressure ulcers and foot drop. Young children can be stressed by being in a hospital. How can you decrease the stress? What's number one? It's your last question. Same routine, parents staying with the child, right? And then there's the toys. So that routine they like, it's parents and toys, food that you can give them. They will be really a lot better off for those little things. Number 3 is Leslie. Good job, Leslie. Number 2, Melissa. Whoop, whoop. Number 1, Karen. Good job, Karen. Number 4, Mavis and Ari. Very good job. Great job on it. I mean, there's a lot of information there. I think I covered it beautifully just with the cahoots. As again, I'm going to send you that PowerPoint that has you one of the recordings I have on the PowerPoint. Remember, chapter 39 is hit really hard. So it's something that if you're looking at the recording, go right to chapter 39. The other stuff is really covered well. Anybody have any questions, comments, concerns? Again, I'll have those exam grades out by about 1 o'clock, between 1 and 2 on Saturday. As soon as I can, they'll be there, all right? You guys have a great evening. Thank you for your patience.
Thank you, Professor. Have a good night.
You too.